Dr. Charles Adams, MD, also known as Chuck. And I'm a traditionally trained internal medicine doc. I tell folks I have an integrative internal medicine practice just outside of Chattanooga, Tennessee, in Ringgold, Georgia, northwest of here. And traditionally trained in internal medicine, all that kind of good stuff. And I started dallying into the wonderful world of integrative medicine. I was shocked to find out that I've got a family member who had blazed the trail, way, way ahead of me. And that would be the good Dr. Denton from Anchorage, Alaska. And so I'll be calling on her here in just a second because she has more experience than I. As a matter of fact, I'm the least experienced person you're going to hear from up here. We've got some good resources. I took advantage of my position as ISIM president to get this hour. And within ISIM, I have one particular role in that I am the backup redneck to Dr. John Parks Trowbridge. So that's a position I have ascended to. All right, we're going to talk about IASIS, or depending on what part of the country you're from, IASIS. Okay, it's potato, whatever. And it is an amazing tool. It's interesting. Oh, no financial interest. Okay, if $1 million gets sold, I just say okay, good. So it's an interesting piece of equipment. It's about the size of an old VCR tape. It's just about that size. And what it is, it's an EEG. I mean, we've all, you know what, EEG, and that an EEG machine that got rewired. And the way it works, 3 electrodes are put in a permanent position, one behind each ear and one at the base of the skull. And then the other 2 are moved on different places across and around the skull, primarily using a system known as the 1020 system, familiar to the neurologist, that one neurologist can tell another neurologist use this position, that, and they will be right in the same spot. And that's the same things that we use in doing the IASIS. So what does it do? Well, it's like an EKG machine. The EKG machine picks up the electrical impulses coming off the heart. The EEG picks up the electrical impulses off the brain. And what's nice about, I don't know if y'all have ever looked at that. I don't know. How do they ever, maybe if there's some neurologists in here, how do y'all ever figure out how to look at that? I guess you got to look at a bunch of them before you can. So we're blessed with a neurologist here. Thank goodness we don't have to worry about that. There's a wave on there that's got all of every wave, alpha, beta, gamma, delta, theta, chi, o, omega, whatever they are. And we don't have to worry about that, thank goodness. The machine worries about it because as it looks at them, it takes the impulses that it sees and it's picking up from the brain and puts it through some different algorithms and will kind of like adjust or boost the nerve transmission from one part of the brain to the other. Now, and let me just use a gross example here, and that is if everything's all nice and good, and let's say this is sort of the configuration of the brain, and when something bad happens, the brain, in trying to protect us, will go into this kind of mode. This isn't easy. I've never done this with a microphone. We'll go like this. Now, if the brain will be nice enough to get back to the way it's supposed to be, everything is good. But sometimes that doesn't happen like it does in the movies when the scene changes. No, the brain stays like this and people get all messed up. Traumatic brain injury, PTSD, so forth. And so what's neat is right now we have the luxury of being able to at least talk about a pilot study that was done out in San Diego with an MEG, magnetoencephalogram. There are not many of those around, and we've seen the one that they used in that VA study. It's kind of neat because there are not many across the United States. But they look at the vets that have had the PTSD, traumatic brain injury, and they, instead of all the magnificent anatomy we're used to looking at on an MRI scan, the neurologists know that this part of the brain should be talking to this part, this pathway and that pathway. And if you've had a traumatic brain injury, those pathways don't work because the brain's still up in this position here, okay? And what the IASIS machine does is it looks at all that and it administers like a homeopathic dose of electricity, and it's like three picowatts, which is 3 trillionths of a watt. And the cell phones I've got here, they're zinging me right now like a millionth of a watt or something like that. And so it's a very low intensity, very low energy, homeopathic type energy that it puts into the brain. And as it, as you go through the sessions, the brain slowly moves back to where it's like, hey, we're okay. I'm back to like I should be. It is not an MD, DO driven type of machine. Folks will get trained, and either you can go to training or the training will come to you in your office. And it's interesting. It's best run by someone who has some intuitive things to pick up with what's going on and what isn't going on with their patient. And another screwball thing about this therapy, most of us are used to more has got to be better. And this doesn't work that way. The longer that they're on it and the more treatments they have, as they start improving, it takes less and less and less, which is a little bit different, a different paradigm than what we're used to, because more's got to do more gooder. And it's no surprise to me that the dentists have figured out how to begin using it in their practice. And so Dr. Zakel has had much more experience than I. Susan Rohr, as well as Sandy Denton, has had a lot more experience, and I want them to come up and share some of their stories. I'm going to share one real quick, and that is I had 2 high school boys that had 1 concussion too many. And both of them went from being A students to being F students. And one of the boys was wearing the school's jersey when he got his concussion, and they kicked him out because now he's stupid. And so, and it's in both of them now, it just worked out this way. Both of them just needed 3 treatments, and both of them are back to being A students. I mean, and the stuff the folks have done this are not surprised, but the other people like, dang, is there anybody else who can do that in here? I mean, I've never been exposed to any kind of therapy that could do that. I mean, you got a concussion, traumatic brain injury, you're done. Or like if you're a good football player, you just put your helmet on, shake it off, and keep on playing. Right there, Joe? But I'd like to get Phil, you want to say a few words? Because I want to kind of divide this up between Dr. Denton, Susan, and you. And Phil is the founder of which one? IA or
late one. I was one of the last ones.
Okay, but which one? Which organization?
IAOMT.
IAOMT, and so he's been using it to some extent in his practice. So, Dr. Zakel, take over.
Okay, thanks, appreciate it. For some of you who've known me for a while, know that a couple of years ago I had a major stroke. And if you know if people have gone through a stroke, you know how difficult it is to recover. And I was going through that. And almost a year ago, I met Barry at an ozone conference, and I was still suffering with depression and anxiety, inability to think clearly, apprehension, all of those kinds of things. I was out to dinner with Bill Chatfield the night before, and he says, you got to go see this guy. So I went over and visited with Barry, and I had 1 treatment, and it was like a veil being lifted off. I woke up the next morning, and the anxiety and the depression and all of that stuff was gone. So I said to Barry, I says, Barry, if this thing really works, I'm going to get this for my office and for my patients, and especially if it works for my grandson. My grandson was a pretty good hockey player. If anybody how many people follow hockey? So my grandson actually played with Ryan Hartman, who's on the Blackhawks, who's a rookie on the Blackhawks, and doing extremely well. But my grandson was suffering from concussions. His gut was all upset. He could hardly eat anything and whatnot. So Barry made arrangements with me and my wife by Skype to treat my grandson. And for about, 6-8 weeks, once a week we would get on and we'd do a treatment for him. Since that time, 2 semesters have passed. He was in electrical engineering at Northern Illinois University. Since that time, he's had straight A's. and his gut is straightened out. He's feeling a whole lot better. The other incident for me was that my wife's best friend had a head-on car accident and was in a stupor, couldn't think, pain, migraine, headaches, and everything. After a couple of weeks, she said to my wife, "Can you help me with this?" So she went over, did a treatment, and right after the treatment, she was washing dishes. She says, "I have no more pain. My headaches are gone." 3 treatments later, she's stable now. So it's the kind of a thing that you don't think of it for your practice necessarily. You think of it for your family, your friends, your loved ones, and the people you care about. And it flows over into your practice. And that's basically what I just wanted to say. Okay. Thank you.
Thank you, Dr. Steele. Susan, why don't you come on up? And I'm going to let you do you.
I'll do me.
Yeah.
Thank you. Hi, everybody. Most of us come to conferences, and I've been to many. We really want to walk away with a nugget, a tool, something that we can take back to our practices to make us better at what we do. And I think that you're in the right room. I, too, am an integrative practitioner. I own an energy medicine clinic in Brookfield, Wisconsin. I'm a nurse. And I found IASIS, and I didn't find it at a seminar. It kind of found me. But I kind of want to give you a snapshot of the practice and me, and then I'll help you understand how I use it in my practice, because the two doctors were really describing a personal need, and I can help you see a personal need and take that personal need and take it into practice, because it works beautifully in practice. And for more details, come to the booth and talk to Barry, because we're not going to go into the super detail of the technology, but actually, Dr. Adams, you did a great job. That was really well done. I learned something. As I said, I own a practice in Brookfield, Wisconsin, energy medicine. I have many modalities. IASIS microcurrent neural feedback is just one of them. My primary client base started out as Lyme disease, chronic Lyme and its co-infections. I am a Lyme survivor, I would say. I still deal with some of the symptoms. One of them was severe brain neurology issues, long-term, short-term memory issues. I couldn't make a bowl of oatmeal. I can now host a 50-person dinner party, but I couldn't do any of those things. I couldn't drive a car. I couldn't navigate getting through our neighborhood. I get lost. So that's where my brain was. And I would say it's not perfect, but here I am 8 years later and standing in front of you. I have everything written out just in case, because this is not my forte, is standing in front of a bunch of people. But I want you to know I believe in this technology. I wouldn't be here otherwise. I have a very, very, very busy practice. I'm very blessed, but there's a lot of sick people out there that need us to know about something like this. So, in addition, besides my own issues, and quickly I digress also, pain is a huge part of my life. My L somewhere, all the way down to S1 has herniated in my body. So I deal with pain on a daily basis. The very first time I had a neurofeedback session was my IASIS training. And we had done, a 12-hour day learning IASIS. Sitting was excruciating. And I had the treatment, and I went home and I went to bed. I couldn't even sleep. I had so much energy. But I went to bed, woke up the next morning. We were in California. California might have something to do with it, San Diego weather. But I got up that morning and I decided I was going to walk because I knew we were going to be sitting. And I actually started to jog. And you have to understand, with the kind of damage I have to my spine, jogging's not in my realm of activity, but I ran that day. I jogged and I felt great. And I thought, wow, something changed. And there was no longer that pathway in my head of pain. Did it stay? No, but I needed more neurofeedback. So that's my story, my personal story. My second personal story is my son. I found IASIS neurofeedback because of my son, Sam. Sam, at the time, was in his junior year playing a tight end at Northern Iowa University. He had had 4 concussions mid-season of his junior year. Now, most parents would say, you're not playing any more football. But this is an adult who has a scholarship, and he's a brilliant athlete, and he's going to play football. That's just the way it is. And I knew that I needed to find something for him, because with my arsenal of technology, I didn't have anything to heal his brain. And at the time, this is when they had all the news was starting to talk about repetitive concussions and what the long-term effects were. And I started to feel sick to my stomach about what was going to happen to him. That's when IASIS neurofeedback came into our lives. It found us somehow. I was praying, and that's how I found it, really. That's how every piece has come to my clinic. So I really didn't fall into the criteria initially that was allowing practitioners to come in. I didn't have the right licensure, but I sent a note to Barry, and he said, yes, come to the training. And Sam, of course, we got him on the treatment in April of 2015 and started to treat him during spring break. Between his first and his 10th session, we started to notice a huge difference. Something also to note about Sam is Sam was autistic spectrum. Sam has a severe expressive language disability. So take that and 4 concussions, and you have a child who's really starting to struggle in school, starting to struggle with relationships, starting to struggle with change in weather, starting to have a lot of digestive issues, not healing from other injuries. So we did, when I could, and he was 4 hours away, when I could, we did neurofeedback on him. By the 10th session, which was the summer, so we started in March, late March, by the summer, he was having expressive, from his heart, from his spontaneous mind, conversations on the telephone with us. This is something that we had waited 21 years for. I'm sorry. Thank you. Sam can now have female relationships because he can actually express himself. He can talk to us on the telephone when he's having a bad day and tell us exactly how he's feeling. He finished his senior year with a 3.5 GPA, and he was playing college football. He was playing with fractured ribs, and pain, but his brain was working, which is a beautiful thing. So that is my story, my family's story. Let me tell you about my patients, and I love every one of them. Just about everybody would benefit from neurofeedback that comes into a clinic that has chronic illness. Your cancer patients, your Lyme patients, your pain-based patients, they will all benefit from IASIS microcurrent neurofeedback. Because when you start working on the brain, the brain and the gut and the body are connected. You all know the body, or the brain, the body connection, the mind-body connection. We all know that. Well, this creates a pathway, an open pathway to the body. and makes the healing process so much easier. So your sickest of your sickest patients, if you can get them to a state of stability, you can talk them into the neurofeedback. Some people come in specifically for neurofeedback, and you realize that you've got to work on their body. And then the combination is like the 4th of July fireworks because they get better. So let me look at my notes so I know that I'm not missing some important pieces for you. Let's talk about 3 case studies of patients. Paul, he's an 8-year-old child presenting with ADHD, pyrrole disorder. Some of you don't know what that is, some of you do. Impulsivity, poor executive function, verbal and facial tics, digestive upset daily, frequent headaches, and poor self-control. This is per mom and teachers and what have you. I use an OnDomed, so if you don't know what that is, you can come and talk to me about it. Using the OnDomed instrumentation, I assessed the patient. He actually had Borrelia burgdorferi, multiple strains of strep, so he was a PANDAS kid. Also EBV and yeast and fungal issues. The main issues parents had was the ADHD. On a scale of 1 to 10, he was a 10 per his patients or his parents and his teachers. He had easy frustration, anxiety. He was very uncooperative, and he had extreme outbursts when he came into the clinic. We did notice facial tics. They were very pronounced. He also was a low ABGAR score kiddo with oxygen deprivation. So after 5 treatments, we noticed significant improvement with focus at school, more cooperative at home, very few temper tantrums. From 5 to 10 sessions, less argumentative, less redirection, reduced procrastination, improved mood. Teachers were calling from the parents, not because he was in trouble, but because they wanted to know what they were doing. Because it was making such a difference. They were like, how do I find this for my other kids? Okay. He, at the 5 to 10, no more facial tics. Obviously, we were dealing with the strep, but there were no more facial tics. The symptoms only escalated when he was put on different medications and or he got an acute infection. Then he needed maybe additional neurofeedback treatment. Let me talk about maybe one other patient for you. I'm going to talk about a 5-year-old autistic child. Going through my charts, this was such a blessing because sometimes you forget where people have come from, and going through the charts forced me to kind of go back into the history of the patient. And I got tearful looking at this little boy because I remember him coming into the clinic. His name is Sawyer. And when Sawyer came into the clinic, first of all, his mom looked like she was going to have a nervous breakdown. How parents look when their eyes are like this big. And they're like, please do something to help me with this child because I'm ready to kill him. He went from couch to couch in my office, jumping, out of control, flying underneath computers, knocking over lamps. Very out of control child. His only diagnosis was ADHD. He really was an autistic spectrum child. We started doing neurofeedback. He was one of my first major neurofeedback kiddos. His complaints were eye strains. They weren't sleeping through the night. He was very physically aggressive. He was fighting with his sibling, actually physically aggressive with his sibling, had stomach aches and food aversions. He was inconsolable, angry over the smallest thing, no eye contact. We assessed him and obviously came up with heavy metals and some other things. But the primary focus for us was using microcurrent neurofeedback. After the first 5 treatments, the patient was less anxious, more agreeable, happier, much less digestive issues, better appetite, and he was handling his emotions better. After treatment 6 through 10, no more nightmares. He had nightmares. He was cooperative. he would actually get onto the treatment space and just sat there and started talking to us. We could actually give him homework to do, and he was doing summer school homework, and his ability to stay focused on that homework was tremendous. I started to add trampoline therapy because I noticed using trampoline therapy in addition to some of the other things with children with that kind of sensory autistic behavior is very, very centering for them. And that's a great thing to do for school for these kiddos. At 11 to 15, the impulse control was so much better that we started to go down to once a week. This particular child, when he came to us, was 3-to-1 aid supervision in the classroom. So over the summer, we worked on him and he went into first grade. This child is now in second grade, does not require any aid supervision in the classroom, and is doing beautifully. So that's so exciting. It's one of many, many, many stories that I can tell you about what we deal with. But I do want to give you just a quick, and I know my time is probably, keep going. Thank you. I want to tell you what we deal with in our clinic. The typical patients we're seeing, besides the Lyme, the brain fog from Lyme, and the trauma from Lyme and cancer. I'm dealing with the autism, quite a few. It seems like we're drawing a lot of autistic children. PTSD has been amazing. PTSD from surgery, PTSD from a life event. There's so much to PTSD. I didn't even realize. People who've been sick for a long time really have PTSD. They can't see themselves being well. This is a great way of helping patients discover a pathway to well-being because they can't see it themselves. Pain syndromes. Oh my gosh, I'm a prime example of pain syndrome. But even my Sam, when he had his elbow torn all the way down to his wrist, being on the neurofeedback, because he had so much trauma from that, it took it away. He kind of relived it one time when I was doing the neurofeedback, but then that fear was gone and he was able to get back on the field. Not that I wanted him to, but it worked. Parkinson's. We have 4 or 5 Parkinson's patients that come in. We have to identify what's going on with them, because it's a multi-system approach to healing them. But one of the things that we have patients do is sign their name and draw circles for us. So we kind of have a benchmark to see where we're at. Always. Tremors, you can see they start out with the tremor like this. The tremors are significantly improved after a session of neurofeedback. And you have to walk your way through how much energy they can deal with. It is a bit of intuition. You have to use a little bit of intuition and observation. That's very important. Amazing for anxiety. Absolutely amazing for anxiety. You have patients coming in with anxiousness due to illness, anxiousness just in general, anxiety, depression, phenomenal for those things. We almost always within the first session see an improvement. And you always ask a patient to tell you on a scale of 1 to 10 how they're feeling, and usually after that session it is significantly reduced. If you haven't gotten 50%, that is surprising. But test anxiety too. We get a lot of kids that come in with severe test anxiety. It's gone in 3 sessions. They just don't have it anymore. I've even had people come in where children literally go ballistic with blood draws, and you do neurofeedback on them, and they go into a blood draw with absolutely no anxiety. So it's another thought. The PANS and the PANDAS kids, the kids with systemic, or even adults with systemic strep infections that have really fire in the brain. What a beautiful combination. I would never have the success with the PANDAS patients if I was not doing neurofeedback. And if any of you are treating PANDAS, absolutely hands down you need neurofeedback. I can't see being successful otherwise. Trigeminal neuralgia, one of those very, very hard pain syndromes, and the dentist will see this too. So if there's any dentist, this will apply to you. You know, that's such a incredibly debilitating pain process. And usually, I would say they're a little bit more complicated, but about 20 sessions, I see they have a normal life and they are coming off of their psychiatric medications, which that's how a lot of the doctors are handling that trigeminal neuralgia. Works tremendous. Head traumas and concussions, obviously, we've touched on that. I've had many patients coming with severe car accident, concussion syndromes, light sensitivities, and still 2 and 3 weeks post-concussion. And in that post-concussion syndrome, this helps that post-concussion syndrome. They will heal better. They will heal quicker. They will heal thoroughly. And I want to say about the concussion syndrome, and like my son Sam, I have full confidence that as we continue to treat that boy who's had 5 concussions, that he is going to be fully healed in his brain. And I know that because of the study that was done at UCSD. I have complete faith. And vertigo. I wanted to touch on that because a lot of people will see vertigo. This has been tremendous with patients with unresolved vertigo. It's been very successful for me. So that's about all I have to say about my practice and my patients that I deal with. Thank you for listening. I really appreciate that.
Like she said, I mentioned the VA study. Let me go back and mention that real quick. Grab a pencil and so I can at least give you the microcurrent, give you the website. And as you're doing that, when you walk into the exhibit hall, if you're walking in, they're in the far corner on the right if you want to talk to them a little bit more about what all's going on and how it works. But the website is www.microcurrentneurofeedback.com. Microcurrentneurofeedback.com. Do I need, and I will repeat it slowly. Microcurrentneurofeedback.com. In the VA pilot study, they had 6 vets with PTSD, traumatic brain injury. They received, and they had the MEG study before, and then they had 2 treatments a week for 6 weeks, so a total of 12 treatments. And I think all of those groups, all of them responded. I always tell folks if they say, was it going to work? And I say, well, there's probably about an 85% chance that it's going to work. I mean, anybody says 100%, beat it. And so they were able to correlate MEG changes. They could see where the neural circuitry had gotten back to firing after they've had those treatments, and the degree that the nerves were working better, that correlated with the amount of progress they had. I mean, some progress better than other. Beg pardon? Oh, I'm sorry. It's an MEG, magnetoencephalogram. I got a picture of the one they probably used in the study just because it happened to be there. And just a little sidebar, the IASIS folks approached the MEG folks and said, "Y'all, you want to take a look at this?" And like, neurofeedback? No. And so some of the vets they were treating came in and were having some studies, and they were like, "How'd you do that? What were these studies? I mean, what happened?" And they said, "Well, we started doing IASIS," and I'm like, "Oh, well, maybe we got to go talk to these folks." And so one thing led to another. Dr. Denton, do you have any cases, or we've talked mostly about younger folks here. And by the way, the 2 boys that I had with concussions, I've let them know in no uncertain terms they ever get into a concussion sport, I'm going to hunt them down and I'm going to beat them to death. So any experiences that? And so I'm proud to present from Anchorage, Alaska. I mean, she has gone catty corner to get here. Dr. Sandra Denton.
Hi there, y'all. I grew up in Tennessee, went to school in Tennessee, so I can pull that off. I'm an ER physician, 13 years, board certified ER doc, and now in May I will have been in alternative medicine 32 years. So I've seen a few things along the way. But I was at an ozone conference a couple of years ago, and Dr. Schallenberger, well, right before I left for the conference, my nurse, who takes a lot of the phone calls, got a call from one of my patients, and this patient said, "Is Dr. Sandy going to get an IASIS machine?" And my nurse said, "Oh no, one more machine. No, 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 no." She did mention it to me at the end of the day, and I kind of got curious. Well, what is an IASIS machine? And it just so happens I always do a lot of reading on airplanes when I have time. And I had gotten Dr. Schallenberger's newsletter. And in that newsletter, he was talking about Lyme patients and using ozone for successfully treating Lyme patients. But he said there was some Lyme patients and some other patients that he had thrown everything that he knows for the last 40 years at these patients, and they still weren't getting better until he started using IASIS microcurrent neurofeedback. Well, that really caught my attention because I have one or two patients that aren't getting better. In spite of the best care possible. And so at that conference, he even mentioned it from the pulpit. He's my mentor, I'm telling you. And so I went straight downstairs, walked over to this gentleman with my credit card in hand, and I said, "I want one." "Nope." "Don't you want me to demonstrate a treatment on you?" "Nope. If Dr. Schallenberger says this is something I need, I need it. And I want to be one of the first people in the state of Alaska to provide it for my patients." Also, he mentioned from that conference about how it helped with sleep. And that made me think about Dr. Teitelbaum's book, From Fatigue to Fantastic. And there's a chapter in there, and I've heard Dr. Teitelbaum lecture a few times. He said, if you don't get the patient sleeping, nothing is going to work. And he even went to the extremes of saying whatever drug you have to use to get the patient sleeping, use it. And that was kind of like, whoa, I don't know about that. But over the years, there were a few times I had resorted to some of the prescription meds to get the patient sleeping. And the minute that Dr. Schallenberger said that this was a tool that would help people with their sleep, it was like, bingo, a non-drug tool that can help people sleep. You know, not only Lyme patients, all my Lyme patients have trouble sleeping, every single one of them. But toxic metal patients, that's one of the keys that I learned from Hal Huggins, was that with mercury, it interferes with sleep. And so, again, another tool when so many of my patients, whether it be from toxins or infections or anxiety or whatever the reason, if I could get them sleeping with fewer drugs, then we were ahead of the game. And it's been successful. I'm very pleased with the treatment. I've had people with interstitial cystitis, irritable bowel, Crohn's. When you think about it, the brain controls all the functions of the body. So it's not just the things that we're looking at with anxiety and depression, but what other functions in the body that the brain controls. Maybe we have a tool that can help reset things to normal and get the patient experiencing what normal feels like, because sometimes it's been years since they've felt normal and they've forgotten what that feels like. So I am thrilled to be able to offer this to my patients, and I encourage you to explore it further.
Thank you, ma'am.
I wanted to mention to the dentist in the group that in my office we have correlated this technology with TMJ and head and neck pain. There are CPT codes that you can use for TMJ and get reimbursement for it. Okay?
It depends. And that's part of it in that about the longest one would go would be about an hour. But on the other hand, it depends on how sensitive the patient is. It might only take, the treatment only lasts like 15 minutes, you know. Okay, Susan says 20 or 30. Do I hear 40? And so it varies. In other words, it's not, but it's not a long, drawn out. What's the longest you've ever done with a patient? 45. Dr. Denton. Yes, sir.
The doctors on the team. Hi, I'm Barry Bruder. It's good to meet you all. We decided early on, the doctors actually decided, when they looked at the technology, that to do a QEEG, a quantitative EEG, in some instances when individuals had enough significant TBI, MTBI, if it was more advanced beyond that and people had open head injuries, there were instances where they said that they would recommend go do a Q before and after. We had numerous individuals that did a Q pre-IASIS and post-IASIS, and it was that technology and it was all of that data that was presented to the folks at UCSD that caused them to go, wait a second, we're seeing before and after here. What would happen if we did this with an overlay of an MEG, magnetic encephalograph, and an MRI slapped on top of it? That's where that difference came in, because then when we did pre and post IASIS, using MRI to show exactly where the parietal injury from the IED blew that marine up, pre-IASIS showing high-level delta waves, slow delta waves, 1 to 4 cycles per second, and then after we got finished with the IASIS treatments, no delta waves. That got Mingjung Huang, our principal investigator at UCSD, very excited, which then got the chief medical officer in San Diego at the Aspire Center, which is the West Coast version of Walter Reed, part of the Balboa Medical Center, extremely committed to begin to refer the Marines. And he didn't ask. He told them, you're going to be part of the study, because he saw one after the next of these Marines, all of the symptoms of PTS, all of the symptoms of TBI, concurrent with something that I'll mention that you may not know about. There's something called the River Mead assessment, which is a verbal assessment on 16 different questions that the psychiatrist or the psychologist, the PhD, reads to all of these individual patients. Well, the answers to all of the questions about their symptoms were in and are in complete alignment with the findings that's in all of these images. And we can't wait to share these images with you, because we actually have, neuro's been around for 65 years. Now we have image-based evidence that neuro is real, and all ships are going to rise, and this is going to really impact psychopharmacology and psychology. When people see these images, it's been submitted to a neurological journal, and within the next 4 weeks, we're going to know. And I'm sure that with the help of Dr. Sukal, Dr. Adams, and the other members of this incredible group of the 4 medical teams, we'll be able to share that with you guys. I wish I could do it now, but we want to get it published properly, and we can't share those images just yet. But it's very exciting to see. And then to circle back around and put a button on your question, because we saw pre and post so many differences in the QEEG, but because in the interest of doctors and their clinicians wanting to use this in their practice, but realize this is highly impractical to be sending people out for $1,000 study before and after, to heck with it. Let's not worry so much about being everything to every person. Let's not do mapping. Let's do help with treatment to help people feel better, and that's what they decided to do. They removed the mapping function, and they really just focus on the healing and on the treatment. Thanks for letting me share all that.
I just thought of something else that, you know, at the end of the day or weekend, whenever I'm faced with tons and tons and tons of charts and paperwork, and I look at that and it's just like overwhelming. If I can get a treatment, no, it doesn't do the charts, but if I can get a treatment, then all of a sudden it's no longer overwhelming and I can just get to it and just focus on it and get them one by one and one instead of wandering all over the place and going 16 different directions. That's huge for me.
So I think that's just about it. I'm not going to have a Q&A because as you figured out, no, I don't know. I'm the least experienced of all of our folks that have handled this mic here today. And so all I can say is I appreciate you coming. Would you all want to have a Q&A with Sandy and Susan and Barry, or go drink coffee? Or it's 5 till 4. I don't know what our in. Susan.
Antibiotics or other kind of herbal treatments for, are you doing other things to deal with the strep?
It depends upon the patient. I am a nurse, so I cannot prescribe. Many of these kids come to me after they've been on many rounds of antibiotics. They've had their tonsils removed. They may have done IVIG therapy, and they're not any better. They still are showing elevated ASO titers and symptoms that are triggered by maybe growth and development, that type of thing. So I get them on herbal and homeopathic protocols, and I also use Rife. So Rife is very, very, very effective. And then the combination of neurofeedback. Neurofeedback really reboots the brain, God bless you, reboots the brain and moves past that damage pathway. Mm-hmm.
Susan just touched on something that I should have mentioned, and that is this therapy doesn't really compete or squash anything else. Like our, chelation will kind of irritate the cardiologist a little bit, and our prolozone will kind of tick off our orthopedic fellows. But this really works best with any other therapy that's, for any other condition. I mean, so everybody's nodding their heads. So I mean, it's that kind of tool that's most useful for your practice. So, any other questions? Yes, ma'am.
I'm not just familiar with that magnetic encephalography. I don't know, or do they give a little bit different information? Can you tell me a little bit about that? And what kind of training do you need?
There's 30 in the country. They're $7 million. They're in every major research institute. So picture a room 7 layers thick of metal. No EM gets in. Now there's a machine. He'll find it. It's about 4 feet wide, 4 feet deep, and 7 feet tall. And there's a little cutout right here. The chair comes in. They're in the chair sits back. The head, parietal area, rests on that little space. It alone reads the EM activity in the brain when they put the electrodes on that individual. And then they take those images. Harvard has one. UCSD has, I think, one of the top ones in the country. And it literally reads very accurately every single electrical impulse that's going on in the brain. And it's the #1 diagnostic tool because of Mingjong Wang at UCSD and all the papers that he's published on a device that has been proven for TBI. So when you look at that device and the level of confidence that science now has in MEG, magnetic encephalography, with an overlay of an MRI to see exactly where that is and seeing what it shows pre and post, They've never seen this before. And Dr. Mingjong Wang has gone one step further. He's actually studied the signal. He believes that what our device is doing, I didn't tell you this, is that it's introducing a delta wave. So think about Samuel Hahnemann. If it's introducing a delta wave and it takes a level of energy equal to or greater than the level of energy that it took it to come about, he believes that it's the delta wave that's neutralizing the delta wave. And all of a sudden these people have no more symptoms. Sounds like homeopathy. To me, that's certainly what it sounds like, and that's exactly what Dr. Huang believes is happening in this, because we see a spike immediately in the delta wave, but we also see a correlate to where the person was blown up or has the injury, and then post-IASIS, there's no more yellow blotch, which happens to also be a visual that goes along with the actual existence of that wave that's no longer there. Yes. Yes.
How many sessions are done usually, and how frequently do you do that?
First, as Susan said, 85 to 90% of the people, I treat people every day in Los Angeles, in Temecula, an hour north of San Diego. Every single provider, we have providers in Asia, Canada, throughout the US. Every single one of them has said they have had the exact same experience. 85 to 90% of the individuals that are treated the first day experience a drop, ranging from I feel something, I feel more relaxed. They came in with an 8 out of 10. It's a 0. They say, I have no anxiety. Is the anxiety an anxiety that is situational or chronic? The response to that will give you the answer to how long before it becomes what I call enduringly sustainable. To get to a point of enduring sustainability with this process, this protocol, if the individual has a situational occurrence happening that you're working with them on, fast. It could be anywhere from 2, 3, 5 sessions. They're good to go. They're done. This is not a crutch. This is not something that they need more of. It's something that they require less of. My goal, get an individual to a point where they come every other, every third, once a month. See ya. Call me if you need me. And I'll actually say, you're good to go. You don't need to be here anymore. You don't need this. Well, but no, you're good. I constantly have people say, should I go off my meds? No, you should talk to your doctor. And if that's something that you and your doctor think you should do, and I never walk around saying anything negative about medication. I say you should do exactly what your doctor tells you to do. I don't want to get on the bad side of pharma. P.S. I love the way that you put that, Dr. Adams. We're not on the bad side, and we're not doing anything that is against pharma. If people happen to feel better and they go to their doc and they say, I'm not feeling anxious, then they may say, well, let's titrate off the benzos. That's a good thing. So 2, 3, situational, 2 to 5 sessions, people are good to go. Once a day. I have people come in. Yep. Yes. Yes. I have people come in from all over the world because they say, you're training the doctors. I want to do this with you. And I go, but we have people all over the world. They're near you. But once in a while, I'll have someone come in who I'll treat 5, 7, 10, 2 weeks in a row. And then they go back and they sustain it and they maintain it. Okay? Amazing for addiction. Helped people to get off of crack, heroin, alcohol. I'm telling you, it's really very, very unbelievably helpful for addiction. And I mean every kind of addiction. Sugar addiction. Enormously helpful for sugar addiction, as long as they're also doing the other thing that Susan Rohr talked about, which is working with the gut-brain connection. Because if you're doing work to support that, it's amazingly helpful. And I'll just say this one thing about sugar and food addiction. There was this one woman in the 18 months that I did clinical trials with Dr. Frank Schellenberger in his office in Carson City, Nevada. And there's a woman, Emily, was coming in, and I was going, wow, Emily, are you on some, I'm always so afraid to say anything. you know. And I go, are you on like some kind of amazing regimen? She goes, I don't raid the icebox anymore. And I just said, wow, what's going on? She said, my anxiety is gone. This was on the second week. She said, I go to my work, and even though I hate it, I just whistle and I get out of there and I feel good. And I'm telling you, this woman lost like 45 pounds in a matter of like 6 weeks. And then she was like, I don't need this anymore. And she left. I didn't see her for 2 months. And then she said, I want a little tune up. Again, I didn't see her for 2 months. It's enduringly sustainable. It's crazy.
Susan was mentioning that her youngest patient was 5. Have you ever done an infant, like for Thrive, for them?
I did.
Good.
I worked with infants. Frank Schallenberger says in the little video that's on our website, quote, I wouldn't hesitate to use this on a pregnant woman, on a baby, any person, any age, any condition. Frank Schallenberger. I've worked with babies, 18 months. I worked on a little boy who was 2. I worked on a boy who was 6, severe frontal lobe injury at the age of 2, needed adult strength sleep medication to fall asleep. After the first session, they came in the next week, and the mother said that was the first time that he fell asleep with no medication in 4 years. And every night he slept after that without any kind of medication. So yeah, lots of little ones. My own kids as well.
I'm just curious because you talked about delta waves. Obviously, delta waves in an awake state is an abnormality.
Yes.
I can't say that. I need your equipment. I'm curious to see if you've done any studies looking at stage 3 sleep where delta waves are prominent, or any other stages of sleep, like a pre and post sleep study.
We've definitely seen pre and post sleep studies, and you still see a functioning, but there's an abnormality to the delta wave in the folks, especially in the area where they got the injury. During sleep, and obviously we know what it looks like when they're awake because we can see it from the MEG. Right. But we definitely see differences in the sleep state where we see more of a predominance of that in the sleep study as well.
And are you also seeing improvements in insomnia and parasomnia?
Huge improvements in insomnia. Folks who have gone everywhere and tried 8-10 doctors have come in and worked with all of us and have gone away saying, I am sleeping without drugs for the first time in my life.
That's phenomenal.
I didn't talk about this patient, but I have a 17-year-old boy who is in the clinic, brand new, maybe 3 months now. He was sleeping 22 of 24 hours. He was woken up by his parents at the 12-hour mark and given an upper per the doctor. And then he was allowed to go back to sleep, and then they would drag him basically out of bed. He has now been into the clinic for 2 months or so doing neurofeedback once or twice a week. He only needs 10 hours of sleep now. So it's done huge things. And he's actually smiling and cooperative and talking to us and giving us eye contact. Actually participating in school, which is amazing.
I have a question. Can you hear? Yeah. So I find this very interesting. I have a son who's TBI. He multiple concussions, and then the last one, and about 3 times to where he blacked out. Couldn't remember what occurred. The last one was bleeding in the occipital lobe, and 2 days later, the right frontal. And so he has a lot of the issue you're speaking of. I'm interested in having this done. First of all, who is a provider in Denver? And again, here she is. Oh, I need to talk to you. But also, he was 18 when the accident, the initial injury, or with the bleeding happened. He was 18. He just turned 24. So is it okay? Is it still effective since there's been a lapse in time in treatment?
Yes, it can be.
Okay, he can't sleep. So he self-medicates and he's turned to harder drugs.
So absolutely, or there's a good chance that he will respond and respond positively. And we've mentioned fairly little numbers, but some people, what's the most number of treatments you've done on one person?
I have a young man who's on the I have a young man who's on the autism spectrum, and we've done 170 sessions. And I constantly say to people, as long as you feel that this is adding value and helping you, do this. When you don't and you're good to go, stop. Don't do more than you need. And I've asked Laura, his mom, many times, Laura, why do you keep doing this for Connor? Because his language keeps improving. Because he's comfortable in his body, because he's comfortable in social settings, and no one has ever been able to give that to my son. His father, Blaine, after the 5th session, looked at me with tears streaming down and said, my son looked me in the eye. He's never looked me in the eye. 18 years old. I continue to work with that boy because I love these people that I work with. It's such a privilege. I just can't imagine to get up every day and go and touch people with this technology and see these changes that are enduringly sustainable, where they don't have to continue to do as much of the drug therapies and so forth. It's just really helpful, and I just want to say that your son, I believe he will feel better. This is one of the most loving, sensitive, skillful individuals, Carol Oliveira, who's in Denver, and I think that he'll be in good hands.
Okay, good. And real quick, it doesn't emit EMFs or anything, right? There's nothing.
Okay, so
radiation
I have a
or
question
anything.
for y'all. Do you have one of these?
Oh yeah.
Do you ever go like this?
I
This-
try not
okay.
to.
It's 1/1,000,000th of a cell phone. It's as Dr. Adams said, it's 3/1,000,000th of a watt or 3 picowatts. Let me put it into perspective. It's 100th of a AA battery for 100th of a second. It is so infinitesimally small that it's almost not there. And like Dr. Adams said, it basically is homeopathic, but it is measurable. Not easily, but it is measurable. Yeah, so you don't have an EM danger there. Yes, please?